Well, don't blame the messenger, but we are only halfway through winter, and the dreary weather is starting to impact some of us here in Western Mass.
Western Mass News reporter Sabrina Riley spoke with a local mental health expert to get answers on what you can do to battle the winter blues.
I just hate this gray weather.
Springfield native Sherry Mengel tells Western Mass News nothing is worse on her mental health than gray skies and gloomy weather.
I've struggled with depression all my life. The summertime I'm okay. And winter, when the fall starts to come after October, November, then I start to, I can feel it going, the depression setting in.
And if you can relate to any of those feelings, the Mental Health Association says it might be because of the weather.
People's moods get affected very easily by weather. When it's rainy outside, when it's extremely cold, and especially when we're fluctuating so much between the hot days where it's 50 degrees one day and then it's 32 the next day, and then it's raining, and then it's snowing.
The exact weather Western Mass has been dealing with for months. Elaine Burgess is the director of the Best Life Outpatient Clinic at the Mental Health Association in Springfield. She tells us that this is typically the time of year they start seeing patients for something called seasonal affective disorder, otherwise known as SAD.
Seasonal affective disorder affects approximately 3 million people in the United States every single year. Traditionally, they do say it tends to hit females more than men, and especially age ranges between 18 and 35.
She says that with shorter days and longer nights, our bodies start to become vitamin D deficient.
What happens is when we have the lack of sunlight, the darkness actually increases melatonin in our brain, which tells us to go to sleep.
Things Sherry notices in herself.
Makes me feel very depressed, very sad, makes me sleepy, makes me anxious. There's not enough sun.
Elaine's advice would be to increase your lighting and make sure you're eating enough vitamin D-rich foods.
For some folks, they may actually want to go to their primary care physicians to see if a vitamin D supplement or other types of vitamins might actually be helpful for them as well.
And if the feeling persists, never be afraid to ask for help.
Local counselors such as Best Life would be very happy to meet with anybody.
For Western Mass News, I'm Sabrina Riley.